Hello, I'm Jacqueline Lapine, Communications Director for the Missouri Department of Health and Senior Services, and I'm joined today by the Department Director, Margaret Donnelly. Margaret, welcome.
Thank you for having me.
Absolutely. Well, we are in the midst of flu season, and actually December 5th through December 11th is National Influenza Vaccination Week, and this week is intended to raise awareness about the importance of getting the flu vaccine and really encourage people to get it through December, January, and beyond. So tell me, if folks have not already gotten their flu vaccine, is it too late for them to do so now?
Absolutely not. I just got my flu shot this last week. And although flu season starts at the beginning of October, it really peaks during the holiday period and into the winter months of January and February. So it is not too late for you to get your flu shot and to be protected all through the flu season.
Great. And tell me a little bit about what is new about this vaccine this year.
We have a vaccine that covers 3 different strains of the flu. Each year, the manufacturers work with scientists to try to determine which strains will be most common and which are already in the population. And the vaccine is then developed to fight against those strains. And so this year, as I said, it's 3 strains, and it includes H1N1.
Okay. And tell me a little bit about who should get the flu vaccine. What's the recommendation?
The recommendation this year is different from before because this year we are recommending that everyone above the age of 6 months get the flu vaccine. We know that some groups are at higher risk from complications from the flu, but you never know who is really going to react very badly to the flu, and so by getting everyone vaccinated, we know everyone is protected. In addition, when the more people we have protected from the flu, the more that we know people who might be at high risk will be protected because there'll be less likelihood that they'll catch it. So that's why the recommendation is everyone gets the flu shot if you're over the age of 6 months.
And why was that recommendation expanded to include everyone above 6 months old? Tell me a little bit maybe about the safety of the vaccine and things of that sort.
Well, we know that the flu hits some groups more significantly in terms of complications, but everyone is at risk from complications from the flu, which can at times be even life-threatening. And so we know that the vaccine is safe and effective for all groups above the age of 6 months, and that's why we went to the recommendation that everyone should have the flu vaccine so everyone is protected.
Well, last year, people had to get different vaccines. They had to get the seasonal flu vaccine and then also the H1N1 vaccine. Is that the case this year where folks have to go get multiple vaccines?
This year, 1 flu shot will do it. The H1N1 virus is still out in the population, and so it was included in this year's shot along with 2 other strains. So 1 shot will do it this year.
And I've heard about a new vaccine that really targets the population of those 65 and older. I believe it's called the high-dose vaccine. Can you tell me more about that?
We know that as people age, their immune system is a little different, and so this vaccine was created in order to give sort of an extra boost to older adults. So if you are over the age of 65 and you receive this vaccine, we know that you will have even stronger protection against the flu.
And getting into the holiday season now, tell me why it is so important to get vaccinated.
Well, the great part of the holidays is that you're together with your family and friends. But that also, of course, creates a situation where when everyone is having lots of interaction and in close quarters, and they may be more tired and feeling stressed, they're more likely to get the flu, and it's much easier to pass it around. So that's why we know that flu season peaks very much often during the holiday period.
And tell me some other ways that people can protect themselves from getting the flu or protect others if they might have it from passing it.
Well, we know that there's some really basic things that you can do, such as be sure that you wash your hands often. Also, if you are going to cough or sneeze, you should use a tissue or a handkerchief to cover it, or as we've seen teaching the new technique, you probably see a lot of kids doing it, but adults should do it as well, is to cough into your elbow, and all of that can help to prevent the spread of the vaccine. If you're starting to feel as if you're coming down with the flu, be sure to stay home, because that way you won't be spreading it to others. But bottom line, the most effective protection is to get that flu shot.
And we know when we're talking about vaccines, that cost and access are two really big issues. So how can people plan to pay for the vaccine when they get it?
Most vaccine is covered by insurance if you have insurance through your employer. It's also covered by Medicare and Medicaid. And if you are uninsured, you can check with your local health department, because they will often have a program set up so that for a very small administrative fee you'll be able to get the shot.
Great. And then tell me, how can folks locate the flu vaccine or flu clinic closest to them?
Well, we do have a new flu locator map set up, and they can click onto the map and find out the location of the nearest site where they would be able to get their flu vaccine. And you can find that flu locator map at the state website, which is just mo.gov, and also at the Department of Health and Senior Services website, which is dhss.mo.gov.
Fantastic. Thank you, Margaret, again, so much for joining us. Obviously a very important issue this time of year. We want everyone to have a very healthy winter season.
Well, our theme this year is the flu ends with you, and so that's why it is really important for everyone to get that flu shot. So thanks for letting me come and talk to you about it.
Absolutely, we all appreciate it. Well, again, if you are looking for more information on the flu and on the vaccine, and for all of the health information you need, visit our website, dhss.mo.gov.